Welcome back, guys. Today we will discuss mental health team. Did you know that treating a mental health patient is never a one person's job? It takes the whole team of expert and each has their own role like superheroes working together to save the day. In this video, let's meet the real mental health team and understand how they help someone to heal from inside out. So let's start the video. So mental health team is also known as multidisciplinary team. So mental health team is also known as multidisciplinary team. So multidisciplinary approach refers to collaborations between members of different disciplines who provide specific service to the patients. So in mental health care, we often use a multidisciplinary team approach. This means different healthcare professionals from different fields come together to provide complete and holistic care to a patient. So this team works together to support patient not just medically but emotionally, socially and mentally. So next we are going to see the members of multidisciplinary team. So it includes seven members. So first one is the psychiatrist, then second one is a psychiatric nurse, third one is a clinical psychologist, fourth one is the psychiatric social worker, fifth one is an occupational therapist or an activity therapist, sixth one is a pharmacist and a dietitian, seventh one is a counselor. So let's discuss it one by one. So first one is the psychiatrist. A psychiatrist is a medical doctor with special training in psychiatry. He is accountable for medical diagnosis and treatment of the patient. So a psychiatrist is a medical doctor who is specialized in mental health. She can diagnose, she can treat mental disorders, she can prescribe medication, she can conduct therapies like ECT. Okay, so these are the things. Next we'll see what are the functions are. So first is admitting patient into acute care setting. So admitting the patient, this is the first function. Then prescribing and monitoring psychopharmacological agents. So prescribing the drugs, drugs such as antidepressant, antipsychotic and mood stabilizers. Then monitoring the condition after administering this drug. Next is administering ECT. Okay, ECT means electroconvulsion therapy. This is a common therapy which is used, so in which electrical current will be there, it will be applied to the brain, which will induce grand mal seizure. So next is conducting individual and family therapy. So individual and family therapy will be given. Then participating in interdisciplinary team meetings, so participating in the team meetings. Then owning to their legal power to prescribe and to write orders. Psychiatric often function as leader of the team. So here you know that psychiatrists, they are the medical doctors, they are have specialized in mental health and they have power to diagnose psychiatric disorders. They have power to prescribe medications, and this because of this only they play a leadership role in treatment of the patient. So next we'll see a psychiatric nurse. A psychiatric nurse is a registered nurse with specialized training in care and treatment of psychiatric patients. She may have diploma, MSc or PhD in psychiatric nursing in care of the patient. So a registered nurse is a psychiatric nurse, okay, and she will have a special training in mental health, and she will assist psychiatrists in administering the medication and observe patients behavior, then plays an important role in daily care and recovery also. Okay, like if example I can give, like if nurse is there, then she will check for the depressed patient now, if he is eating properly, then sleeping properly, is taking medicines on time regularly or not, she will see. So next are the functions. What are the functions of the psychiatric nurse means? So first one is administrative monitoring medications. So monitoring, giving the medications and monitoring the medications. Then assisting in numerous psychiatric and physical treatment. So assisting in the treatment of the patients. That can be physical or psychiatric treatments you have to assist. Okay. Then participate in interdisciplinary team meetings. So participating in the meetings. Then owning to their legal power to prescribe and to write orders, psychiatric often function as a reader. So she will, what she will do, she will this monitor, she will give the medicines, then she will observe for any behavior of the patient. So in by this only she plays a role of the leader. Okay, this other something. Then we'll continue. uh, Teach patients and families. So she will teach patients regarding the particular disease or things, like how to take care of them, and then how to prevent mental illness and all. Okay, then take responsibilities of patients record. Then she will take responsibility that patients records should be kept confidentiality, so she will take responsibilities of that. Then act as patients advocates. In specific situations she will act as an advocate also, and interact with patients significant others. So she will interact with patients and others also, like family members and others who are, if they need their help means she will interact with them. Then third one is clinical psychologist. A clinical psychologist should have a master's degree in psychology or PhD in clinical psychology with specialized training in mental health setting. He is accountable for psychologic assessment, testing, and treatment. He offers direct services such as individual, family, or marital therapies. So this clinical psychologist will be there. He holds what master's or PhD degree in psychology. Then he will provide psychological assessments like IQ test, personality test, then offers talk therapy, then helps in behavior modifications and coping skills also. Like example can be like a person with anxiety is guided through relaxation technique and behavior therapy sessions. So this is one of the example of this. A psychiatric social worker. So a psychiatric social worker is a worker should have a master's degree in social work or PhD degree with specialized training in mental health settings. So this psychiatric social worker will be there. He should have a master's degree in social work or PhD degree in specialized training in mental health setting only. Okay. Then he is accountable for family case work and community placement of patient. Then he will focus on social aspects of the patient's life, like family, environment, finance. Then he conducts group therapy sessions also. Then he empathizes interventions with patients in social environment in which he will live. Then he will connect patients with community resources, conduct family therapy, and he will educate the families also. Example, a social worker helps to arrange financial support for a patient who cannot afford medications. Okay. So next we'll see occupational therapist or an activity therapist. So an occupational therapist or an activity therapist is accountable for creation, recreation, occupational and activity program. So he assists the patient to gain skill that help them to cope more effectively, to gain or retain employment, to use leisure time. So the occupational therapist will be there. He will train patient to perform daily life activities and even gain independence. He will encourage participation in recreational and vocational activities also. Then he will help the patient to get ready to rejoin school, jobs or society. Like example, an occupational therapist teaches a patients with depressions how to follow a daily routines and enjoy habits again or hobbies again. Next is a counselor. So a counselor provides basic support. Your counselor and assist in psychoeducational and recreational activities. So counselor is the one who provide basic emotional support, and he will listen to the patient's problem also. Then he will offers individuals and group counseling, and he will assist in psychoeducation sessions also. Example, a counselor will help a teenager to deal with exam stress through regular counseling also. So this is the counselor. Okay. So, with this, we'll end our today's session. Thank you for watching. Like and subscribe the channel.